In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
I'm here in the West End Rehabilitation Center in the heart of Berlin, and I'm talking to the medical director, Dr. Jürgen Homberger. Hello. We just saw in the report a woman with type 1 diabetes, and she was working out a lot. She was always exercising. Why is exercising so important in the treatment of patients with diabetes?
Well, sports and exercise is healthy for all, of course, but especially for diabetics. Activity reduces blood glucose levels, and it improves insulin sensitivity, and decreases weight and builds up muscle and protects against heart disease or stroke.
What kind of patients come to your center?
Rehabilitation is useful, for example, for patients after hospital stay due to diabetes, in order to return to activity, to daily life. But we also treat long-standing diabetics if they need support, motivation to sports and exercise, but also psychological support if the disease becomes a problem for the patient.
We just saw the patient in the report. She was a type 1 diabetic. There's another form of diabetes which is called type 2 diabetes, which is a more common form. What's the difference between the two forms?
Type 1 diabetes is an autoimmune disease. As a rule, children are already affected. Even in early years, the body produces no more insulin at all. And the type 2 diabetes affects adults. At first, a lot of insulin is produced, and this high insulin level can damage organs and vessels.
Patients with type 2 diabetes are usually a little bit older and in many cases obese. So the widespread opinion is that they're self-inflicted. Is this true?
Well, I would not talk about guilt regarding disease. And in addition, inheritance plays a major role, especially in type 2 diabetics. But lack of exercise and being overweight is the more important factors in the development of this type of diabetes.
What does your program here for the treatment of diabetic patients consist of? It's not sport only, there's something else.
Yeah, right. A whole team works with the patient. We doctors provide education about the disease. Psychologists help with the management of the disease. They are nutritionists. We have social workers who clarify questions about work, occupation or pension.
Many of my diabetic patients are very afraid of switching to insulin instead of tablets and pills. Can they do anything to prevent getting insulin?
Well, in early stages, they do not need to take any drugs if they do physical activity. And even later, tablets are enough for a long time. And even if they need insulin, they need much smaller doses if they do physical activity.
And if you prescribe physical activity, what kind of exercises do you prescribe? More like cardiovascular exercise or more like weight training?
Well, best is a combination of endurance, that is jogging or cycling, and muscle training, for example, with a fitness ribbon.
Exercise also helps you to lose weight. How important is weight reduction?
For the majority of the patients, this is the key to success.
So after your patients finish their treatment here at your center, how do you motivate them to continue the new lifestyle?
Many are experiencing the fact that it is fun to move and that the sugar values are simply better than before, and they take this message home with them. But if you have a group of like-minded people, it's more fun to do activity in groups, and sometimes the groups find together here and do sport together and socialize with each other after the rehabilitation.
When it comes to nutrition, quality and quantity does matter. And now here are new members of the team. It's Chef Thomas Bildstein, hello, and Marlene Hoff. Hi, hello. Welcome. Many of my patients are afraid that they are not able to eat regularly when they've got diabetes, that they can't enjoy their meals. So, but you're a chef, so you can do some magic here with the food?
I can.
Yeah, right.
Here in my restaurant we make many meals and desserts without sugar, healthy, fruity and tasteful.
So you try to take out the sugar out of the meal. Is it very important to take out sugar of the meal altogether if you're diabetic?
No, it's not the sugar itself. It is the amount of calories which we eat each day.
Patients are coming to you as a dietitian and you have to give them some advice. So what's the first advice you give? Was ist das Erste, was Sie dem Patienten tatsächlich empfehlen, wenn als Diabetiker zu Ihnen kommt?
First of all, I recommend that they change their diet. Eat healthy, fresh foods. Limit themselves to 3 meals a day to lose weight. It's very important for type 2 diabetics to lose weight to prevent or reduce subsequent conditions. That will help lower the risk of continued elevated blood sugar levels. And if they eat less carbohydrates to lose weight, as everyone else should do too, by the way, then they'll achieve that goal.
So, and to lose weight, is it important to use all those fresh ingredients?
It's important because when you cook fresh food yourself, you can pick your own ingredients. You can pick the right kind of fat, for example. Ready-made products often have the wrong type of fat, and that's bad for blood vessels that are usually diseased anyway due to high blood sugar levels. And you can use all kinds of spices and fresh herbs when you cook. And you can cook low-calorie meals that way.
But to prepare your own meal from all the fresh ingredients, I mean, it's a hassle in our daily life. It's very hard. It's much easier to go to the pizza place and order some pizza. How do you motivate your patients?
Well, they see and learn here that it makes more fun to produce the meal on their own, either to call a delivery service.
Many patients like to take a shortcut, to say, well, cooking is one thing, but there are supplements which I can get from a pharmacy. Is it possible to treat diabetes with some, say, homeopathic drugs or with supplements?
No, you can't treat it. And if you eat a varying, healthy meal, you don't have to use any supplements. All the products we need, all the vitamins are in a normal, healthy meal.
So what are we going to eat today? I mean, it's not just carrots, is it?
No. Today we have fish, we have vegetables, we can see, we have rice, and at dessert we have an apple compote with fresh fruits, with seasoned fruits.
Okay.
These meals are rich in vitamin D, in vitamin B12, in calcium, in zinc, and in omega-3 fatty acids.
So the best nutrition is a Mediterranean diet, and you can stick to this, and so
Exactly.
you can prevent yourself from getting diabetes.
Exactly.
Okay, so I will continue doing all the preparation here of the fresh stuff, and then we're going to have a nice meal.